Hello, my friend. Today we are going to talk about a subject that is rarely discussed openly, but which is part of the lives of practically all men, regardless of age. If you are over 60 and still masturbate, this video was made especially for you. It is an intimate, personal topic that many men avoid discussing even with their doctors or partners. But it is an important subject that deserves our attention, especially when we talk about men's health after the age of 60. Don't worry, I'm not here to judge or dictate rules about what you should or shouldn't do in your private life. I'm here to share important information that can make a big difference to your overall health and well-being. Many men in your age group have questions, concerns, or even feelings of guilt about this very natural practice, and today we are going to demystify some concepts and shed light on this subject. Before we continue, I want you to know that this conversation is based on scientific information and is aimed exclusively at your physical and emotional well-being. If you are feeling uncomfortable with the topic, take a deep breath, relax, because we are dealing with something completely natural and important for your health. Let's talk about how masturbation can affect your body after age 60, the benefits and potential risks you need to know about, and how to integrate this knowledge to improve your quality of life at this very special stage. I firmly believe that information is power, and having knowledge about all aspects of your health, including your sexual health, can bring you more security and peace of mind to fully enjoy this stage of life. Shall we begin? Many men over 60 feel that their sexuality is a closed chapter in their lives, or something that should decrease dramatically over the years. This is a misconception that unfortunately still persists in our society. The truth is that sexuality is part of who we are throughout our lives, and that includes masturbation. When you reach the age of 60 or older, your body undergoes several natural changes. Testosterone levels gradually decrease, which can affect your sex drive and your ability to get and maintain erections. Often, this new reality makes men feel less confident, less virile, and this can have a profound impact on self-esteem and emotional well-being. Masturbation, in this context, can play different roles depending on how you practice it and how often. That's why this video is so important. Let's take a look at how this practice can impact your health at age 60 or older, so you can make conscious and healthy decisions about your intimate life. Scientific research has shown that regular masturbation can have several benefits for men of all ages, including those over 60. One of the most relevant benefits is the maintenance of erectile function. Like any other muscle or system in the body, the sexual system also benefits from regular use. Periodic stimulation can help maintain adequate blood flow to the genital region, which is essential for sexual health. This works almost like exercise for your reproductive system, keeping it active and functional. In addition, masturbation can help reduce stress and anxiety, thanks to the release of endorphins and other hormones related to pleasure and well-being. For many mature men facing challenges such as retirement, relationship changes, or health issues, this can be a natural method of relaxation and tension relief. Another potential benefit that is rarely discussed is the possible contribution to prostate health. Some studies suggest that regular ejaculation, whether through sexual intercourse or masturbation, may be associated with a lower risk of prostate problems. Although more research is needed to confirm this relationship definitively, there is evidence that regular sexual activity may help clean the reproductive system by eliminating substances that could contribute to inflammation or other conditions. And we can't forget the psychological aspect. Maintaining a healthy connection with your sexuality can contribute to a better quality of life and a more positive view of aging. Many men report that maintaining some level of sexual activity, including masturbation, helps them feel younger, more vital, and more connected to their own bodies. If you are watching this video, you probably have some concerns or curiosity about this subject. Perhaps you wonder if it is normal to continue masturbating after the age of 60. Maybe you are concerned that it could cause health problems, or that you should stop completely. Or perhaps you are looking for information on how to adapt this practice to the natural changes in your body. Whatever your motivation, I want you to know that you are not alone in these doubts. Sexuality in old age is still a subject surrounded by taboos and misinformation, and it is completely natural to have questions about it. You are taking an important step by seeking reliable information on the subject. Now, before we continue, I would like to ask you something. If you find this content useful or believe it could help other men in the same situation, please like this video. This simple gesture helps us reach more people who can benefit from this information. And in the comments, if you feel comfortable, write the phrase, "Health is a priority," to show that topics like this need to be discussed openly and without prejudice. Your participation can encourage other men to also seek information about their intimate health without shame or fear. Remember that when we talk about important issues like this, we help break taboos and allow more people to access information that can significantly improve their quality of life. Returning to our topic, it is important to understand that masturbation itself is not harmful or something that should be avoided after age 60. However, like any activity, how you practice it and how often you do it can make all the difference between benefits and potential problems. Let's now talk about some aspects you need to consider. First, frequency. There is no ideal number of times a man over 60 should masturbate per week or per month. This varies greatly from person to person, depending on factors such as your natural level of sexual desire, your overall health, any medications you may be taking, and your lifestyle. The important thing is to observe how your body responds and adapt the frequency according to your well-being. If you find that you are masturbating compulsively, as a form of escapism or to the point of interfering with your daily activities and relationships, it may be time to reflect on your habits or seek professional guidance. On the other hand, if you have a healthy sex drive and occasional masturbation is part of your sexual expression, there is no reason for concern or guilt. Another important aspect is technique. As you age, your body changes and you may need to adapt the way you stimulate yourself. The skin of the penis can become thinner and more sensitive, requiring more care and possibly the use of appropriate lubricants to avoid irritation or minor injuries. The pressure applied may also need to be adjusted. Many men develop a habit of using too much pressure during masturbation, which can decrease sensitivity over time and make it difficult to achieve pleasure during sexual intercourse with partners. If this is the case for you, it may be beneficial to try gentler and more varied techniques. It is also essential to pay attention to the mental content that accompanies masturbation. The visual or mental stimulation you use can have a significant impact on both the physical and psychological aspects of the experience. Seeking healthy and realistic content that does not create unrealistic expectations or promote a distorted view of sexuality can contribute to a more balanced relationship with your own intimacy. Remember that your sexuality does not need to imitate standards set by the media or youthful conceptions of what is normal. The beauty of maturity lies precisely in the freedom to discover and value what really works for you and brings genuine satisfaction. It is also important to talk about masturbation in the context of relationships. If you have a partner, masturbation can be a healthy part of your sex life together, and not necessarily a substitute or an exclusive activity. Open and honest communication about desires, needs, and comfort is essential to ensure that both partners feel respected and valued. Some couples find that incorporating mutual or shared masturbation can bring new dimensions of intimacy and pleasure to their relationship, especially when age-related physical changes may require adjustments in how sex is practiced. This openness to exploring different forms of intimacy can strengthen the bond and keep the flame alive even after decades together. Now, let's address some common concerns that many men over 60 have about masturbation. One of them is the fear that this practice may somehow deplete their sexual energy or erectile capacity. This is a myth that needs to be debunked. Your body does not have a limited supply of erections or sexual desire that can be depleted by masturbation. In fact, as we mentioned earlier, regular sexual activity, including masturbation, can help maintain active and healthy sexual function. Another common concern is the possibility of developing a dependency or addiction to masturbation. While it is possible to develop compulsive behavior in relation to masturbation, this is relatively rare in older men and is usually associated with other underlying psychological factors such as depression, anxiety, or relationship problems. If you find that you are using masturbation as a way to cope with unresolved emotional issues, or if you feel that you have lost control over this behavior, it is important to seek professional help. Not to treat masturbation itself, but to address the emotional issues that may be manifesting through this behavior. There is also concern about the impact of masturbation on prostate health. As mentioned earlier, some studies suggest that regular ejaculation may be associated with prostate health benefits. However, if you have a history of prostate problems, it is important to talk to your doctor about how your sexual activity, including masturbation, may affect your specific condition. Each case is unique, and your doctor will be able to offer personalized guidance for your situation. Something that is rarely discussed but extremely relevant is how to deal with the changes in sexual function that naturally occur with aging. Many men over the age of 60 notice that they need more time to become aroused, that erections may not be as firm as before, or that orgasms may be less intense. These are normal and expected changes, but they can be challenging to accept emotionally. Masturbation can be a safe and private way to explore these changes and learn to adapt to them. Instead of focusing on what isn't like it used to be, you can discover new forms of pleasure and satisfaction that work for your current body. This adaptation and self-knowledge can even benefit your sex life as a whole, including with partners. Let's now talk about how you can make masturbation a healthier and more beneficial practice after age 60. First, consider incorporating good quality lubricants. With aging, the skin tends to produce fewer natural oils, and the genital area is no exception. A good lubricant can prevent irritation, make the experience more enjoyable, and protect the sensitive skin of the penis. There are several options on the market, from water-based lubricants, which are compatible with condoms and sex toys, to silicone-based options, which tend to last longer. Avoid using products not intended for this purpose, such as body lotions or cooking oils, which may contain irritating ingredients or be difficult to remove completely. Another important aspect is maintaining good hygiene. Wash your hands thoroughly before masturbating and keep the genital area clean. This may seem obvious, but it is a simple precaution that can prevent infections, especially considering that the immune system may not be as efficient with advancing age. It is also recommended to explore different techniques and approaches. As we mentioned, your body is changing, and what worked perfectly at 30 or 40 may not provide the same satisfaction now. Allow yourself to experiment with different touches, varying pressures, and even incorporate fantasies or mental stimuli that resonate with you today. Remember that there is no right way to masturbate. What matters is what brings you pleasure and well-being, always respecting your personal values and limits. Also consider incorporating Kegel exercises into your routine. These exercises, which involve contracting and relaxing the pelvic floor muscles, can help strengthen the area and potentially improve both erectile function and the intensity of orgasms. They are simple exercises that can be done discreetly anywhere and at any time. To perform them, simply identify the muscles you would use to stop the flow of urine, and then contract those muscles for a few seconds before relaxing. Repeating this movement for a few sets daily can bring noticeable benefits over time. Mindfulness can also significantly enrich your experience. Instead of masturbating mechanically or with your mind elsewhere, try to focus completely on the physical sensations and pleasure of the moment. This practice not only intensifies the experience, but can also help you reconnect with your body and your sexuality in a deeper and more satisfying way. Many men report that conscious masturbation, with full mental presence, can be much more rewarding than masturbation performed in a hurried or distracted manner. Another crucial point is to be attentive to your body's signals. If you experience pain, unusual discomfort, or notice any changes in your genitals during or after masturbation, it is important not to ignore these signals. Consult a healthcare professional to investigate the cause. Sometimes what appears to be a problem related to masturbation may actually be a symptom of an underlying health condition that requires medical attention. Open communication with healthcare professionals is essential to ensuring your overall well-being, and that includes aspects of your sexual health. Unfortunately, many men avoid discussing sexual issues with their doctors out of shame or embarrassment, which can lead to undiagnosed or poorly managed problems. If you are one of the many men who regularly follow our channel and value the information we share about men's health and maturity, consider subscribing so you don't miss any of our content. Click on the subscribe button now and activate the bell to be notified whenever we publish a new video. Our goal is to provide reliable and practical information that helps men like you live this stage of life with health, vitality, and well-being. By subscribing, you not only ensure continuous access to relevant content, but also help our community grow, allowing us to reach more men who can benefit from this information. And remember, your intimate health is an important part of your overall well-being and deserves attention and care just like any other aspect of your health. Now, let's address an issue that many men over 60 face: How to deal with masturbation when the medications you take affect your sexual function. Several medications commonly prescribed for conditions such as high blood pressure, depression, anxiety, or heart problems can have side effects on libido and erectile function. If you are experiencing these effects, masturbation can become a frustrating experience. In these cases, it is important to talk to your doctor about the side effects you are experiencing. Sometimes it is possible to adjust the dosage or switch to alternative medications with less impact on sexual function. Never change or discontinue medications on your own, as this can pose serious risks to your health. While working with your doctor to find the right balance between treating your health conditions and minimizing side effects, you can adapt your approach to masturbation. This may include choosing times of day when medication levels in your blood are lower, or exploring different forms of stimulation that work best for your body in the new circumstances. Remember that sexual pleasure is not limited to full erection or orgasm. Expanding your definition of pleasure and satisfaction can open up new possibilities even when facing medication-related challenges. One aspect that deserves special attention is the relationship between masturbation and mental health after age 60. This stage of life often brings significant changes such as retirement, loss of loved ones, transitions in relationships, or changes in social roles. These transformations can profoundly impact your emotional well-being and, consequently, your sexuality. Some men may turn to masturbation as a form of emotional comfort during difficult times, which is completely natural. However, it is important to be mindful that this practice does not become the only coping strategy for emotional problems. If you find that you are using masturbation primarily as a way to escape negative feelings such as loneliness, sadness, or anxiety, it may be beneficial to diversify your self-care strategies. This may include regular physical activity, meditation, meaningful hobbies, strengthening social connections, and, when necessary, professional psychological support. Masturbation can be a healthy part of your self-care repertoire, but ideally it should not be the only tool. An emotionally balanced life also tends to promote healthier and more satisfying sexuality. Another important topic is masturbation in the context of specific medical conditions that are more common after age 60. If you have diabetes, for example, you may experience changes in sensitivity and erectile function due to the effects of the disease on your nerves and circulation. In these cases, masturbation can be a way to maintain some level of sexual activity, but it may require adjustments. Working with healthcare professionals who understand both your medical condition and the importance of sexual health can help you find personalized strategies that work for you. Similarly, men who have undergone surgeries such as radical prostatectomy, removal of the prostate, may experience significant changes in sexual function. Masturbation can be part of the sexual rehabilitation process after such procedures, but it often requires patience, experimentation, and sometimes the use of assistive devices. Studies show that regular stimulation, even when erectile function is compromised, can contribute to the recovery and maintenance of long-term sexual health. Again, follow-up with professionals specializing in sexual medicine can make a big difference in outcomes. Speaking of devices, it is worth mentioning that there are several products on the market designed specifically to improve the sexual experience of older men. From ergonomic vibrators that require less manual effort to vacuum pumps that can assist in achieving erections, there are a variety of options available. If you are curious about these resources, seek information from reliable sources and, ideally, talk to healthcare professionals who can guide you on what might be most appropriate for your specific situation. Remember that there is no reason to be ashamed of exploring tools that can improve your quality of life, including your sex life. Another relevant aspect is how masturbation can relate to intimacy with partners after age 60. Some people mistakenly assume that masturbation and sex with partners are mutually exclusive or competing practices. In reality, they can complement and enrich each other. Masturbation can help you maintain a connection with your sexuality during periods when sex with partners is not an option, whether due to physical distance, health issues, or other factors. In addition, through masturbation, you can discover new forms of pleasure that can later be shared with your partner, enriching the experience for both of you. For long-term couples, introducing elements such as mutual or assisted masturbation can bring novelty and variety to their sex life, which is particularly valuable when physical limitations may make some previous practices less feasible. The key to integrating masturbation in a healthy way into a relationship is open, honest, and respectful communication. When both partners feel safe to express their desires, needs, and limits, it is possible to build a sex life that continues to be a source of pleasure and connection even after decades together and with the natural changes that come with age. It is also important to debunk some misconceptions about masturbation after age 60. One of these is the idea that this practice is somehow juvenile or immature and should be abandoned with age. This notion has no scientific basis and can deprive mature men of a natural and beneficial expression of their sexuality. Human sexuality is a fundamental part of who we are throughout our lives, and its expression evolves and adapts to different stages, but it does not disappear or lose legitimacy with age. Another misconception is that masturbation is only a substitute for sex with partners, and therefore unnecessary or undesirable when in a stable relationship. In fact, masturbation and sex with partners are distinct experiences, each with its own value and place in an individual's healthy sex life, regardless of age or relationship status. There is also a myth that frequent masturbation can cause or aggravate problems such as erectile dysfunction. Scientific evidence does not support this belief. In fact, as we mentioned earlier, regular stimulation can help maintain sexual health. The erection problems that many men experience after age 60 are usually related to factors such as hormonal changes, medical conditions such as diabetes or cardiovascular disease, side effects of medications, or psychological issues such as performance anxiety. Masturbation itself does not cause these problems, and in some cases, it may even be part of the solution by helping to maintain blood flow and tissue vitality. Another aspect that deserves attention is the importance of maintaining realistic expectations about your sexual function after age 60. Many men become frustrated when comparing their current performance with what they experienced in their youth, or with unrealistic images promoted by the media. It is essential to understand that changes in sexual response are a normal part of aging. These changes do not mean the end of your sex life or your ability to feel pleasure, they just require adaptation and, often, a redefinition of what constitutes a satisfying sexual experience. Masturbation can be a valuable tool in this process of self-discovery and adaptation, allowing you to explore your changing body in a private, pressure-free environment. A crucial point that is rarely discussed is the relationship between masturbation and male self-image after age 60. Many men base a significant part of their identity and self-esteem on their virility and sexual performance. When age-related changes affect these aspects, an identity crisis or decreased self-esteem may occur. Accepting that you can continue to be sexual and feel pleasure, even if in different ways than in your youth, can be an important step in maintaining a positive self-image as you age. Masturbation, when approached with a mindset of exploration and self-care, can help reinforce your connection with your evolving masculinity and sexuality. It is also worth noting the importance of taking care of your overall health as the basis for a satisfying sex life, including masturbation. Factors such as a balanced diet, regular physical activity, stress management, quality sleep, and abstinence or moderation in alcohol and tobacco consumption have a direct impact on sexual function. Studies show that men who maintain healthy habits tend to better preserve their sexual function as they age. This is because sexual health is intrinsically linked to vascular, hormonal, and neurological health, all of which benefit from a healthy lifestyle. Thus, investing in your overall well-being is also investing in your ability to continue enjoying sexual pleasure, whether through masturbation or relationships with partners. If you are enjoying this content and believe it is providing valuable information, please like it and share it with friends who could also benefit from this information. Your support helps us continue to produce quality content on important topics related to men's health in maturity. And if you haven't subscribed to the channel yet, now is the perfect time to join our community. Click the subscribe button right now. That way, you won't miss any of our upcoming videos on health, well-being, and quality of life for mature men. Remember that taking care of your health in all aspects is the best way to ensure a full and satisfying maturity. One final aspect I would like to address is how masturbation can relate to spirituality and personal values after age 60. Many men were raised in religious or cultural contexts that disapproved of or even condemned masturbation. These internalized messages can generate feelings of guilt or shame that persist even into middle age. It is important to recognize that different spiritual traditions have varying views on sexuality, and that these views have also evolved over time in many traditions. If you experience conflict between your spirituality and your sexuality, it may be valuable to reflect on how to integrate these two important dimensions of life in a way that is healthy and authentic for you. Some people find comfort in talking to more progressive spiritual leaders or therapists who understand the spiritual dimension of life. Others come to their own conclusions through deep personal reflection. The important thing is to seek a resolution that promotes your overall health and well-being, rather than perpetuating feelings of guilt or shame that can be harmful to both your mental and physical health. Remember that in many spiritual traditions, self-care and self-love are fundamental values, and taking care of your sexual health can be seen as part of this self-care. As we come to the end of our video, I would like to emphasize that sexuality and maturity, including the practice of masturbation, is a topic that deserves to be addressed with respect, empathy, and based on reliable scientific information. There is no single formula or set of rules that applies to all men over 60. What works for one may not work for another, and the important thing is to find out what is healthy and satisfying for you, considering your overall health, personal values, and specific circumstances. Masturbation after age 60 can be a natural and healthy part of your sexual expression, contributing to your physical and emotional well-being. However, as with any aspect of health, it is important to approach it with awareness and adequate information. If you have specific concerns about your sexual health, including masturbation, don't hesitate to consult healthcare professionals. Although it may seem uncomfortable at first, doctors and other healthcare professionals are prepared to discuss these topics with respect and confidentiality, and can offer personalized guidance for your unique situation. Remember that aging does not mean giving up your sexuality or pleasure. In fact, many men report that maturity brings a new perspective on sexuality, with less pressure to perform and more focus on genuine pleasure and emotional connection. This can be a phase of rediscovery and renewed appreciation of your body and your sexuality. The key is to adapt to natural changes, keep an open mind to new possibilities, and above all, be kind to yourself in this process. Before we close, I would like to extend a special invitation to those of you who have watched this far. If this content has been helpful or has brought new perspectives on your health and well-being, consider subscribing to our channel and turning on notifications. That way, you won't miss any of our upcoming videos on men's health in maturity. Your likes and comments are extremely valuable to us, as they help us understand which topics are most relevant to our community and reach more men who can benefit from this information. Share this video with friends who might find this content useful. Often, a simple share can help someone who is experiencing similar doubts but may not feel comfortable seeking information on their own. Together, we can break taboos and promote a healthier and more positive view of male sexuality in maturity. I sincerely thank you for your attention and trust. Remember that you deserve to live this stage of life to the fullest, with health and well-being in all aspects, including your sexuality. Take care of yourself, respect your body and your needs, and continue to seek reliable information that can help you make informed decisions about your health. See you in the next video.